Good morning, Chairman. I appreciate the invitation to be here today, and I am from Houston, Texas, but I must admit I got there via New Jersey and specifically Middlesex County, where I was born and raised. I represent America's health insurance plans. If I may, I have expanded written testimony that I would like to submit for the record.
Where were you born in Middlesex County?
New Brunswick.
Oh, terrific.
We're here to discuss the crucial role that Medicaid plays in meeting the needs of people with disabilities. AHIP is a national trade association composed of 1,300 health plans which provide coverage to more than 200 million Americans. More than 300 AHIP plans bring health services to almost 20 million people served by Medicaid. I'm CEO of one of those health plans, Amerigroup Texas and Southwest Region CEO of Amerigroup Corporation. I even have to look, that's a mouthful. Our company provides health care coverage to 1.7 million people in 10 states and the District of Columbia, all of whom are enrolled in Medicaid and other publicly funded programs. We have been working for 9 years to help Medicaid better serve people with disabilities through a nationally recognized program in Texas called STAR+. Amerigroup's Chief Executive Officer, Jim Carlson, recently said, "We recognize that health care is often a cause of dependency for people with disabilities. Health care should not be the end for these individuals. It should be a means to an end, in this case, a full, self-sufficient, and independent life." STAR+ has taught us that through innovation and hard work, Medicaid can offer Americans with disabilities a full, self-sufficient, and independent life. To explain what that really means, I want to tell you about Henry. Henry is 75 years old and lost everything in Hurricane Katrina. He relocated to Austin where he knew no one. He had many major health problems, including an aortic aneurysm and a history of seizures. When he got to Austin, he was suffering from dehydration and exhaustion. He was on 11 different prescription drugs. He was hospitalized and then went directly to a nursing home. Henry didn't want to be there. He wanted to take care of himself, but he needed a little help. The expansion of STAR+ into Austin in February was a catalyst for that help. Amerigroup service coordinators completed a detailed individual assessment of the kinds of services Henry needed to live independently. Working closely with ADAPT, a wonderful organization and a valued partner of ours that is well represented here today, we helped him find and furnish an apartment. We connected Henry with attendance services, Meals on Wheels, an emergency response system to support his transition to the community. We again worked with ADAPT and made sure he saw a doctor and got his prescriptions filled when we were faced with an obstacle from the nursing home and trying to get him out. The result is that 9 months after leaving a nursing home, Henry is living on his own and hasn't been admitted to hospital care once. He is living the life he wants to live, and STAR+ is not only working for Henry, it's working as well for Texas taxpayers. By helping Henry avoid unnecessary stays in hospitals and nursing homes, STAR+ saves a lot of money. The Texas Health and Human Service Commission has concluded that STAR+ sharply reduces inpatient hospital admissions and cuts overall health care costs by 6.5%. That's why after years of carefully nurturing STAR+ as a pilot program in Houston, the state recently expanded it to 3 more major metropolitan areas. Enrollment has more than doubled to 153,000. STAR+ is a rarity in American healthcare, a program that helps people live better, healthier lives, and at the same time saves money. It does this by tailoring the healthcare system to fit the needs of individuals instead of forcing individuals into institutions that do not offer the right care or services for them. There are other programs in other states like STAR+, but there are far too few of them. STAR+ is one of the oldest and most advanced. Others are still in various stages of development. We strongly urge Congress to support programs like this. For example, Amerigroup has endorsed the Community Choice Act of 2007, House Resolution 1621. It would eliminate the historic bias in Medicaid, as has been discussed at length here, in institutional-based health care, and fund more community-based programs like STAR+. We at AHIP understand that Medicaid is not for everyone. Those who have adequate financial means must secure health care coverage that meets those needs. However, millions of Americans with disabilities cannot do this alone. As folks have said, Medicaid is their lifeline. We must and can make Medicaid work better both for Americans with disabilities who depend on it and for American taxpayers who finance it. Thank you again, Mr. Chairman. I'll be happy to take questions.
Thank you, Ms. McCormick.